Hello guys, my name is Zhambol Kabdrashitov. I am an assistant lecturer at the Department of Surgical Disease in School of Medicine, Kokshetau University, named after Shukhan Walikhanov. Our name of our course it's the Introduction to Surgical Disease. And first of all, we will talk about objectives. So by the end of this lecture, you should be able to, first of all, to describe how to perform a systemic history and physical examination of a surgical patient, interpret common surgical patient symptoms and signs into a diagnosis, describe the importance of investigation in confirming diagnosis of surgical patients. So first of all, what is the surgery? Surgery is a very big branch of medicine that deals with the physical manipulation of a bodily structure to diagnose, prevent, or cure an ailment. It also refers to performance of such procedures by a surgeon. So it's about operation. Why do we need to perform surgery? Historically, in 5th century, a French surgeon named Ambroise Paré stated that there were 5 reasons to perform surgery. These are to, first of all, eliminate which is superfluous, restore that which has been dislocated, separate that which has been united, join that which has been divided, and repair the defects of nature. We have 3 major obstacles in surgery. The obstacles are pain, bleeding, and infection, of course. Advances in these fields have transformed surgery from a risky art into a scientific discipline capable of treating many diseases and conditions. Also about history, the first surgical techniques were developed to treat injuries and traumas. All the surgery that is evidenced is trepanation, or another it's boreholes or craniotomy. BC setting bones and splitting intramedullary fixation with wooden splints is reported in early Spanish texts. You can see at this picture number 2. Anesthesia using alcohol or opium is one of the oldest surgical techniques reported. So what is the main terms which we're using in surgery? Of course, it's pain, cauterization, ligatures, and infections. About spread through contaminations written by Ignaz, washing hands and aseptic techniques by Lister. So nowadays we're also using of these techniques of washing hands. Antibiotics by Louis Pasteur. Yes, he is the father of all of antiseptic and aseptic techniques. Anesthesia by dentist Horace Wells in 1840. Also opened as ether and chloroform by John Snow, and muscle relaxants, for example, curare. Yes, it's also very important for our operations for mere relaxation. Classification divisions of surgery, very many general orthopedic, yes, it can be pediatric, cardiothoracic and vascular, plastic or reconstructive, maxillofacial, gastroenteric, neurosurgery, urology, and nowadays this very big also has like a bariatric, like metabolic, very specified types of surgery. So surgeries can be diagnostic, exploratory, reconstructive, curative, palliative, transplant, elective, urgent, and emergency. So what is the difference between urgent? It's a type of operation which performed immediately when patient come to your department. Emergency, it's an operation we can prepare patient for these types of operation. According to magnitude, it can be major, medium, and minor. Also, palliative operation is also another type using in oncology. Especially, it's type of operation which we cannot remove the main reason of this surgical disease, but we can help patient for good quality of life. Surgical history or demographs, or another, it's a biodata, of course, name, age, gender, occupation. Presenting complaints, we ask about complaints, history of presenting complaints or present illness, systemic inquiry, past medical history, we ask about chronic disease, operation, accidents, admissions, family and social history, about alcohol, smoking, mobility, accommodation, or another bad habits, obstetric and gynecological history for female, and drug and allergy history. And also we ask about previous hemotransfusion and epidemiological features. Yes, but now after coronavirus, we ask about from patients about these features. Approach to physical examination, it can be a general examination. Next, after that, for us, very important, of course, it's a local examination. Yes, for every data, every history of patient had a local examination. Yes, very spread with written all features, for example, of various localized pain, or where is located some passes or another. Inspection, of course, and for us very important, also general medical examination, which include palpation, percussion, auscultation, and another special test. Important surgical symptoms for us: pain, swelling, vomiting, cough, bleeding, dysphagia, change in bowel habits, abdominal distension, difficulty in micturition, and joint stiffnesses. For pain, yes, definition, it's an unpleasant sensory and emotional experience associated with actual or potential tissue damage. Can be classified into somatic or autonomic depending on organ or of origin. We should ask about sight, be stabbing, sharp, dull, burning, itching, colicky, and so on. Radiation or rever, aggravating or relieving factor, timing, and severity, of course, of this pain. Swelling, also important. History of swelling, yes, where is its onset, the course, duration, painful or painless, other lumps, effects on general condition, cause, does the lump disappear. For examination of swelling, we're using inspection. We should measure size, we should determine shape, it is symmetric or no, surface, skin overlying, and scars. Special signs like pulsation, cough impulse, movements associated with swelling. As also we using palpation, we can sense tenderness, skin temperature, size, surface, is it smooth, irregular, nodular, ages, consistency, and so on. Consistency of swelling can be cystic, fluctuation. Fluctuation, it's a term we're using for pus, for example, furuncle, for carbuncle, and another type of abscess. Paget test, it's a solid tumor is most hard in the center, whereas a cyst is least hard at its center. And can be solid, it's a soft, firm, indurated, and hard. Other specific diagnostic signs of lumps, it's a pulsations, transillumination, neck lymphs, and hernias. For hernias, we're using examination like cough impulses and reducibility. Neck lumps, thyroid gland, thyroglossal cyst, and lymph nodes. Transillumination, for example, in hydrocele or cystic gigroma. In percussion, we can sense dull is or resonant, Auscultation essentially over arteries and pulsating mass. Listen to breathe. In conclusion of this our lecture, we should know about definition of surgery, background and classification of surgery, outline of taking history of surgical patient, outline doing PE of a surgical patient, common surgical symptoms and signs, we should know it and remember, evaluation of pain symptom and evaluation of swelling. Thank you for attention.